Hi, my name's Kimberly Miner, and today I'm going to be showing you guys how to put your patient on a bedpan. So it's about 12:23 on October 27th of 2020, and we're just going to go ahead and get into it. So the first thing you're going to want to do is the 5 universal steps, and then we can just head right into it. So the first thing you're going to want to do with any procedure is raise your bed to a good working level. You do not want to hurt your back. Alright, so now I'm just going to go ahead and put a pair of gloves on. Second hand's always the hardest. Alrighty, so then I'm just going to go ahead and lower the bed rail, and you're not going to want to leave your patient once you do this. So I've got a fracture pan today. My patient likes this pan better because the regular one hurts her behind. So I'm just going to uncover the patient, but not too much. Give her some privacy still. And then I'm just going to ask her to grab the bed rail on the other side normally. My assistant's going to help me roll. So you're just going to want to take the bedpan and have the handle towards the front of the patient so it doesn't hurt their behind. And you're just going to set them down, ask them if that feels good, if they have any pinches or anything. And she's doing good, so we're just going to go ahead and cover her up, provide some privacy. Alright, so now I'm just going to give my patient some bath tissue to wipe up with and make sure she's got her call light in reach so she can let us know when she's done. I've also got a trash receptacle here so she can throw away her tissue if we're going to do I&Os or if that's just easier for her. So now we're just going to go ahead and raise the bed rail. Remember, you don't want to leave your patient with that down. And then we're going to lower the bed all the way back down to reduce fall risk. Now I'm going to go ahead and start raising the head of the bed so it's easier for the patient to use the restroom. It's very hard to go laying down. So now I'm just going to take my gloves off, do some hand hygiene, and I'll come back when she's done. Alright, so our patient's hit the call light and she's ready to go. She's also throwing away her tissue. So the next thing I'm going to do is I'm going to raise my bed back up. Alright, so once we're done raising the bed, we're just going to go ahead and lower the head of the bed. So I'm also going to ask my patient while I do this if they had any issues wiping up, and she didn't, so that's great. So now we're just going to go ahead and uncover our patient, and you need to support the edge of the bedpan while you roll so you don't dump urine or feces everywhere. So I'm just going to go ahead and check my patient's rectal area, make sure she's clean, and she is. So we're going to go ahead and set her back down, and I'm just going to cover her up. And then we're going to offer some hand antiseptics since she did just wipe. Okay, so now that we're done, we're just going to do our universal finishing steps. Always make sure the bed's lowered, patient's comfortable, they have their call light. And then we're just going to need to dispose of our urine contents correctly. We're just going to remove our gloves, wash our hands, and then you're going to need to record the results. So that includes amount, quantity, and odor, and then you're finished.